Welcome. So this is the fifth episode of Sublime Studios podcast, and today we have a very special guest. We have Dr. Farah, who is a neurosurgeon with the heart in neuroplasticity. We're going to talk about that. We're going to talk about all the other aspects of just meeting each other and this story about Fashion Community Week and how we've met together. Essentially, we've met as on a fashion show, and she was a model. She was a model there. So we'll go about this. So Dr. Farah and also your hosts Nick and Eugene. So Dr. Farah, could you tell a bit more about well, first, what's your name, and talk a bit more about why are you in neurosurgery, and what does it have to do with modeling at all?
Oh, you ask loaded questions. I'm Farah Fourcand. I am a neurologist by training. I did my fellowship in stroke, neurocritical care, and then I am now completing a fellowship in neurointerventional surgery, which is minimally invasive brain surgery from anything from strokes to aneurysms to blood clots in the veins, in the head, in the neck, and in the spine. I'm probably one of the few women in the specialty. It's a very male-dominated field. I think there's probably about maybe 7 or 8% of people or doctors in neurointerventional surgery are women, but I'm representing. Mm-hmm. And I met you at a fashion show, which happened sort of serendipitously years ago. So when I was an intern, which was, I guess, 7 years ago now, wow. A modeling agent approached me on the street and said, "Oh, you should be a model." And I thought, what in the world are you talking about? Even though people had told me that over the years, and I stayed in touch with her over the years, and I was on call for like 24 hours at the Veterans Hospital, and I was on call from like Thursday morning to Friday morning. Mm-hmm. And after that, I got a weekend off. So I did New York Fashion Week with her and walked some designs for an emerging designer. And it was my first time doing it. My first time walking in heels for a long time, because I wear scrubs and like every day is a completely different animal, you know? So it was different, but I psyched myself into it and just told myself you can do it. And it worked out well. And then after that, I, at the time, lived in Washington, D.C. because I was doing my residency training at Georgetown, and I was doing a physician scientist track between Georgetown and the NIH. Mm-hmm. So I pretty much did like charity fashion shows and different events in DC. DC has like DC Swim Week, DC Fashion Week, and it was really cool. And I liked being a role model for the other girls because they were like really surprised that I was like not just saying, "Oh, well, one day I want to do this and one day I want to do that," because a lot of people have aspirations and dreams, and
not just them.
But and then you do proof of concept also, like, okay.
Yes, but the blood, sweat, and tears required to get there is a completely different thing, and that's a fact. You know, when I was in college, I think half of my class was pre-med. By second year, a third. By third year and fourth year, a fraction of that. And people who actually got into med school was a fraction of that. People who actually go into a really, really subspecialized thing is even a fraction. It's like it's different. So just I think being an example that you can do all of that first, mm-hmm. and still have the energy and the youthfulness and energy to take a step back and do all those other things too, and have that security of knowing that you're established in your career, but you can still enjoy life. You can still be a normal person. It's not one or the other, which I love.
Amazing. I like how you say like normal person, like like define normal. And it's actually
I'm just a girl like trying to I don't take myself very seriously. I have to try sometimes I have to because other people are, I'm like, girl, guy, whatever. We're all people, we're all the same, whatever. It's not.
I have a few questions. But yeah. Before that, you look amazing in this dress, and you're wearing very nice outfit. Looks like at your work. That's amazing.
I got it for about $10 because I
Also practical.
like I was on call. I didn't have time to pack well. I needed to have clothes that would make me look like a grown up, and I went and I bought some stuff for like $10 my first day of the conference, and just trying to just rock it out. It's
That's
nothing.
nice. So neurosurgery and the modeling or art is like totally. Do you feel they are opposite fields, or do you feel like there is a overlap between them?
Overlap. I think there is some overlap. I've never thought of it that way. What I think of is mostly that I just enjoy. I love neuroscience anyway.
Mhm.
I love the extremes of life. I love experiencing things to their fullest potential and their fullest extent. And I think like doing what I do professionally and doing what I do in modeling are two extremes that are very like immersive and very challenging in their own ways as far as putting yourself out there. When I'm sitting there trying to coil an aneurysm from inside somebody's blood vessel in their brain, and I'm like, well, I hope this doesn't pop and cause them to have a and you have to maintain your cool and your calm and your composure and your like serious face. You're like, ooh, it's similar actually. When you're nervous and you're like, oh, this dress doesn't really fit me, it's probably too long, I'm gonna trip over it. No, there's people out here, they have an expectation of you to be a certain way. Keep it together, keep your face on and just do it. And if anything, those are the two similarities, like off the top of my head.
So you are breaking stereotypes, because if I imagine a doctor, I just imagine, okay, serious guy or girl, and then they are always serious at home, at work.
Like Dr. House, right?
Dr. House. But you are showing the other side of it. That's wonderful. It's so unique.
Well, I mean, I think like a big thing, a lot of times I can speak from both perspectives, but sometimes some doctors are a little bit quirky and don't have the most common or most agreeable set of social skills. It happens, and very, very, very smart people sometimes, they're a little odd. They're interesting, they're wonderful, but they're not
opinionated,
and that's fine, and that's okay, and that's probably in some ways better. But
you are showing that it's okay for a doctor to have
the artist side,
or the funny, or
yes,
like the jolly side.
Yeah, and like one thing that I really like about putting myself out there in other ways is that it just shows that we have a human side. We're vulnerable, we're relatable, we are just want to connect, we're just living life. And like, of course, a lot of us, what's funny is people have it's like people in different spheres of life keep themselves sort of separate sometimes, and they don't always communicate. They're very smart, but they don't communicate between their spheres of interest. The fashion community, they don't talk to doctors don't talk to them. Or just like living in their bubble and taking like a bird's eye view on something else and seeing and trying to almost hypothesize what's going on. But when I really think about it, a lot of the doctors I know who are a little more shy, a little more reserved, I tell you, we had a party to this conference on Sunday night, or I don't know, Sunday night, and I saw some things and I was proud. I have a video of it too, which I guess I can share because it's like...
Sounds like all the dirt.
No, it wasn't that bad, but I was so proud, of them like dancing, getting down, drinking, being like people. And you know what? They felt comfortable doing that because it was a group of their peers. If they were doing that in like a local like nightclub, everybody would be like this super stiff, doing nothing. It's because we're so used to being in a certain bubble and we're so like emotionally and professionally invested in it. Getting out of that is very hard. So you can see a doctor who's like in his or her 20s or 30s looking like they haven't done anything in their life but read books, but they have a side that if you saw it in the right circumstance, oh, you'd be like, yeah, that's really good. So I was very proud.
That's
I mean,
oh.
I like to venture out and just do stuff. Like on the first day of the conference, I just went out to like a local nightclub by myself and went out dancing, and I met a group of like girls, and I just had a good time. But like that's not necessarily the norm, but it's certainly it's cool because then it gives people a different perspective. Like, oh, you know, and I'm like, it's not just me. The other ones are like that too. They're just a little more shy.
Yeah, and I can relate to this. A part of my family is actually in healthcare, so they're doing pulmonology, like curing lung diseases. And so my aunt, she is exactly like you're explaining. She's like very serious and trying to be like professional, you know, reputation and stuff. But there is another side of her, which is, you know, the partying vibe, you know, and essentially she got married to a musician because of all those, you know, like.
That is interesting.
Exactly. You see, so it was a combination. This is how I know them, you know. He was the entertainer part, you know, this, you know, kind of like the dark side, you know, the fun side, and she was always, you know, this professional and, you know, like we're going to do things right, and they were just needing each other, you know, to kind of complement.
Yeah, I feel like many of the intellectuals, they have like both sides, extreme sides.
Of course.
So I can relate to that also. Like I was doing intern with a physicist, a researcher, so I was part of that. And so we had conference coming up, and then we were all preparing for a month for that conference. So they were all physicists who were coming to the conference and preparing for a month, right? And then you are like just focused on that. You don't do anything else for the whole month, right? You're just focused on like preparing and doing research and writing paper and all those, and then preparing presentations. And then, okay, the conference happened. And after that, okay, we have to do something. So everyone is like, okay, what should we do? What's the party thing here? What is the party thing in the city? And
where is the after party?
What's the after party? What's the after party for physicists? Okay, can you imagine? I never imagined what the after party for a physicist would be. I thought, okay, they'll go to somewhere like, okay, maybe some museum or something like that, or some science building or something like that. And then everyone was like, had an underlying agreement in their eyes. Okay, we are going to the dance club #1, and there was none good open at that time. So we ended up going to, in my second time in my life, we ended up going to a gentleman's club.
Strip club, even.
Oh my god.
I could never imagine.
Oh my
Yeah.
god. I have some stories, but I'll keep it PG. But yes, in that school we had some
I could never imagine that. Okay, physicists, bunch of physicists who had written like so many papers, who was so famous, and they're so serious. We have to like take it out, like enjoy the moment kind of thing. Night. Okay, next day you're flying out.
Moment,
Yes.
you know.
So yeah, I can relate to that. It's so amazing, and it's lovely to experience the extreme sides of whatever you do. So if you are into like some intellectual thing, you are doing some research, you do go extreme there, and if you are on the other side, go extreme there. So that's how the fun for life is.
So
I think like some of the extremes have helped me like really like to make me take a step back, and it helps when you live in extremes, it helps you be very centered.
mhm.
It really does.
You have, so basically when you are having multiple sides to you, they're like rails. You need like multiple, at least two rails to be stable and be somewhere in the middle and just, you know, keep the track. So that's a very, very sweet analogy. So you mentioned that this Sunday was fun. Anything else happened funny on this conference?
Funny?
Yeah.
Let me see. So Saturday I presented a poster on I'm just going to go through it in my head so that I can remember the funny things, because I have to go through all the motions.
Yeah.
Sunday I presented a poster. All of our posters have been about like neurointerventional stuff and stroke. And then Sunday Saturday I presented a poster, Sunday I presented another one, and then I did a talk on a thing I'm really, really passionate about, like small vessel disease stroke, which I guess is not exciting, but sort of to me like super exciting to talk about it later. It's really cool, whatever. I won't get into it and get like sidetracked. And then Sunday we had the party, and like the guys they were playing like 90s throwback, and you saw like these like
And think Backstreet Boys
50, 60-year-old guys just getting down on the floor, getting drunk.
twerking.
That will be awesome.
We're twerking.
Yeah, why not? I mean, don't limit yourself.
And I was there like, what? Hey? And we have our little like drink tickets on our little thing, but I know they were hitting it hard. It was awesome. Yeah. And then we had like a little bus that picked us up and dropped us back. And then Monday I presented another few posters, Tuesday some posters, Wednesday a poster, today a poster in the morning, and then I just presented a topic on using it's finding the connection between the heart and the brain.
Mm-hmm.
But in between there, I've mostly just seen, like people being a little quirky, people being a little weird, but nothing like outrageous. I just have like little moments where I'm like, wow, I wish that I could be a fly on the wall sometimes and understand or see what people are doing, because there's some interesting characters.
Yeah, and it's also this conference vibe where you're meeting a lot of random strangers, and you kind of like, well, the first day is, oh my God, there are so many cool, interesting people, here. And let me talk to all of them. And then second day, like, well, oh my God, we met yesterday. I remember you. By the fifth day, you kind of start to hate them already because it's all the same conversations.
My heart doesn't have any room for hate in it.
Oh, look at you. This is so sweet.
It doesn't. Like, seriously, I'll understand.
Either you are lying or you are an angel from another world.
I'm not an angel. I'm just not. I just see things for what I see things in my own way. And I don't know if it's better, different, or whatever, but I've always been that way. And I had like a very interesting upbringing and difficult sort of circumstances. So I have a high tolerance for BS, and I can smell it from a mile away. But I also try to understand people that are a little bit different, not the nicest, not the this, not the that, because everybody has a story, everybody has a reason, and there's always a backstory, and I do not. There's very few things that are hard stops for me.
So you're open-minded. Well, sorry for the play of words here. Let's talk about open minds.
I'm beyond open-minded. Probably a little too much, but I'm really open-minded. I'll try anything.
Yeah. So that's actually a really good bridge into getting a bit nerdy for next maybe like 15 minutes. So let's talk about the brain. Your favorite topic, I guess, right? Or at least you heard something about it. The brain, and you mentioned that you are a neurosurgeon, but your heart is in neuroplasticity. So I've been watching some podcasts on about neurosurgeons, and what's most fascinating to me is what we talked about a bit earlier, is that the brain is a very unique organ from multiple points of view. So it consumes like 20% of all the blood flow, for example.
It does, yep.
It is the only organ which needs chemistry, electricity, and biology to function, and that technically it controls pretty much everything in your body. So when you open brains, can you see things about that can tell a bit more about the lifestyle of a person, how much they've been using their intellectual capacity in their lives? Can you see anything like memories, like emotions there, or is it just somewhere? It's basically all the brains are the same.
So no, not all.
Which part is strong, which part is weak, kind of thing, right?
So not all brains are the same. I would say if the brain is the kind of thing, if you have like a baseline neurological reserves or reserves based on your genetics and based on your epigenetics, meaning like what you're born with and what genes are turned on and off based on your environment.
Yes.
And then as you grow older, the epigenetics are more and more impactful. What we usually see is things happen clinically first, visually first, in the person first. In, you know, one person's 50 and another person's 50 can be completely different things. One person's 50 can be like acting like the son or daughter of another 50, and that's because of their neurological reserves. So one marker that we see is sometimes when we do just imaging, just non-invasive imaging, like an MRI or a CAT scan, when somebody has, we're comparing two people of a similar age, sometimes we can see there's atrophy of the brain or shrinkage of the brain. The brain shrinks. The brain is mostly water. It requires most of our energy and most of our, like you said, 20%. If somebody's lifestyle has been, you know, characterized by living hard, drinking,
By the
smoking,
partying component of it.
not drinking water, just being hard, like, and they don't have, they're not like genetically perfect, we'll see some shrinkage of the brain, and that's one of the first signs.
And the
Now,
cool factor.
yeah. And like shrinkage of the brain is not necessarily, it's not necessarily symptomatic. So somebody may have atrophy of the brain, may have some shrinkage of the brain that's a little bit out of proportion to age, because as we age, the brain shrinks a little bit. They may not have any signs of memory loss or cognitive impairment, but another person with the same degree of atrophy may have that, may have memory loss, and maybe the reason they're getting that scan is because of that. Another person may have it by accident because they get in a car accident and they just get a random scan of their brain. So another factor is when we also look at imaging, sometimes we look at MRIs. And an MRI, somebody who has, based on their lifestyle, and they sometimes can have like white matter disease, where you'll see, like, I wish I had a picture of it, like I could share like a PowerPoint or something, but
you can send those pictures to me later. I will add them to the video in post-production. Yeah.
So if we have like a MRI of the brain, we can see that sometimes we'll see shrinkage on the outside, but on the inside, we'll see all of this white patchy stuff. Now that's a sign of that the small blood vessels, the small little blood vessels that are not even, they're not like your big arteries in your neck or your heart. These are like little tiny butterfly wing, delicate little arteries. They're very, very susceptible. On an MRI, sometimes you can see white matter disease, which is a sign that there's been compromise of the very, very small blood vessels. And there's an association with cognitive impairment with dementias and the increased burden of that white matter disease, which I'll show you later. Now, from a more invasive standpoint, so when we do, you know, it's not always about the organ itself, but it's about the route to get there, right? So the brain as a whole is there, but the brain isolated from anything else can't do anything. It's dependent on the blood, the oxygen, the nutrients, and all of that it needs to survive, to thrive. So a big factor is the neurovasculature, which is pretty much the blood vessels in the brain. Now, the blood vessels in the brain, I'm thinking like from a holistic perspective, the veins and the arteries kind of connect everything to everywhere. And there's other systems that connect everything to everywhere, like our lymphatic system. The brain has a lymphatic system. That's a whole nother cool thing. But one thing that we notice is when somebody has a stroke, which is usually an indicator that something is wrong, you know, whether it's epigenetic stuff where they've had poorly controlled blood pressure, cholesterol, diabetes, they have underlying cancer, they have a reason for their blood to be thicker than normal, they have atrial fibrillation, which is an abnormal heart rhythm, whatever it may be, something's not right. Now, we see strokes usually in the older people, but sometimes we see them in the young as well, especially in the context of COVID-19. We've seen a lot of young people with strokes with COVID. So, but we can tell the health of the brain by its blood vessels. So when we go in to do like a mechanical thrombectomy, which is a minimally invasive surgery that we do emergently at any time of day or night to try to remove the blood clot that's causing compromise to the brain. Now, when there's a blood clot on the left side of the brain or the right side of the brain or in the brainstem, the consequences of that are just whatever part of the brain is affected, the person will have those effects, whether they can't speak and they can't move the right side, or they can't move the left side and are ignoring that side or whatever. But when we do our procedures, we'll notice that we use like little miniature catheters and wires to go all the way from like the arm or the leg all the way
The
up
leg,
to the,
yeah. Mm.
and we'll notice that like the arteries are hard and we can't even move our catheters, and we're like shoving things and we're like, whoa, this is getting really dicey. This person's lived a hard life. Their blood vessels are like, they have cholesterol plaques on them, they have
Yes, sclerosis.
on them. The clot that's causing the blockage is very hard and very, it's just not, you can tell a lot by that. And then from a visual perspective, from an open perspective, usually the brain itself, just, you wouldn't really be able to infer too much by looking at it. But sometimes even like an aneurysm, sometimes when we treat it, it can look a certain way endovascularly, but when it's treated open, it can it can also be gross and hard and have like cholesterol plaques and all of that. So it's something, it's a very, that's why it takes the, what is it? It takes a village, or it takes a team to, or a comprehensive understanding of everything to really interpret what you see in one way and what it actually means. It's a very like, not one modality tells you anything.
Okay, so all I understand is like traffic jams are bad for brain.
Yeah. The brain
Make sure that you make a good highway.
Traffic jams are bad.
Clear your highways, freeways. Always keep it
I agree.
clean.
You know what I say? I'm a brain plumber. I'm a plumber. No, that's it. It's plumbing.
That's a good way to put it.
You either open things up and let the brain get blood flow and be happy and preserve itself, or you plug things up if they're causing problems like aneurysms or AVMs or whatever. It's like, you know, everything is simple. When people talk about what they do, I realize they always try to make it sound more complicated than it really is. And I don't know why, but I've noticed that. And I try to simplify it.
Yeah.
It's not rocket science, you know.
Well, you mentioned something very, very, I think, complex and simple at the same time, the happiness, which is, again, like combination of chemicals produced by the brain. So is it just on the chemical level, or are there any other factors which make basically what it is to be happy from the brain point of view? And can you do anything externally to make your brain more susceptible to be happy?
So the first part of that question is, is it just neurochemistry that makes us happy? It's not, but it's extremely important. And serotonin, dopamine, acetylcholine, which is like the learning neurotransmitter, epinephrine, norepinephrine, and there's others. And they work in synergy with one another. And none of them work in a mutually exclusive way. They work in synergy to develop some sort of homeostasis or balance where they can travel from their original point of production to the route in which they go to in the brain. So it's really interesting is that there are certain neurotransmitters that are made in certain parts of the brain, but the brain is like a relay race. It's like a monorail. It's like like you said, a train track or something, or a giant plumbing system, so to speak. So things sort of travel about and around. And when you have an imbalance of those neurotransmitters or brain chemicals, they can have repercussions. And that's what we see in people with depression, people with anxiety, people with like neuropsychiatric diseases like schizophrenia, bipolar disorder. It's all about where in the brain those brain chemicals are out of balance. In the frontal lobes, it can be somebody who's very disinhibited and just, you know, acts extremely inappropriately and doesn't seem to care. In the temporal lobes, it can be somebody who, you know, has memory issues or is very sort of withdrawn. It really sort of depends. But a lot of times you can sort of not trick your brain, but you can work around certain things, because it's not necessarily the administration of medications and things like that that are going to fix a problem. Because a lot of times you'll see people with neurological diseases and or neuropsychiatric diseases and mental health issues, and medicines don't help them. If anything, they sometimes make it worse and they stop taking them. And then there's all this stuff on the news about oh, this person had XYZ and they weren't taking their meds, and that is such an unfair, like I love to make things simple, but that's not fair to like put it down to those like that sort of basic skeleton framework.
Some degrees
So
of complexity.
one thing always fascinates me, and I guess I can now understand fully about it, is how placebo effect are so strong and they work so effectively.
Oh, they
It's
work.
so amazing to just imagine that how can, like, you're doing 20 years of intense research and you come up with something and there is like placebo effect, and like both can cure the patient, and they have sometimes as good as effect. Like, it's so mind-boggling.
So the placebo effect is so cool. As much as I personally don't like it because I want my research to like actually like make a difference. I don't want placebo
Work,
effect,
yeah. You want
but I
work
respect,
stuff.
but I fully respect that. And it's because, there's like this thing like mind over matter, right? When
Mm.
it depends on what the placebo is, but if it's something, for instance, for mood or for anxiety, when you in the right environment, when you foster something and you nurture it and you give it something, a lot of times that helps the brain sort of help itself.
Mhm.
It balances its own brain chemicals. It balances its own electromagnetic imbalances and abnormalities, and it can work. It doesn't. It really is sometimes when there's certain diseases like neurodegenerative diseases like Parkinson's or ALS. That's not going to happen. That's not going to placebo is not going to work.
Oh yeah.
Some of the other diseases that are more like neurobehavioral, neurocognitive, neuropsychiatric, they can certainly work. And I think that's extremely cool. Like, if anything, it's empowering. It's like your brain has the power to heal itself. And that's why there's so much focus on meditation and all of these mindfulness things, because mindfulness and
Mhm.
actually doing that stuff is effing amazing. Like, if you can actually do it, you can really stimulate your brain to navigate itself in the way that it was naturally supposed to be. When we
Mhm.
interfere and sometimes give medications and give something as simple as this is something completely aside from the brain, but when you take a probiotic and you think,
Yes.
oh, this is going to help my gut health, great. When you think about it, your gut has its own like community. It's like its own little country in there. There's little bacteria that want to start a war. There's other ones who want peace, and then they're out of balance, right? When you give a probiotic, you just put a bunch of random good stuff in there, and they're like, who are you? You don't belong here. But when you give something like a prebiotic, that is something that stimulates or gives nourishment
The growth, yeah.
to the flora that's already there.
Mm-hmm.
And then you just make whatever's already in you better, rather than putting in random soldiers who don't know who you are and may not even help. So it's about like giving your body a chance to help itself.
Yeah, and like gut is actually connected to a lot of other organs, and
Oh yeah.
the gut affects a lot of not just health, but also things like your mood, for example.
Oh my
See?
God, this is also a passion of mine. So go ahead.
Yeah, there is a thing called like leaky gut. If you heard about this, right? So if,
Yeah.
it's when the lining of the gut is kind of letting the bacteria from the gut get back into the bloodstream, and that's where you can feel like consistently sick, like having all this inflammation going on. But that's not coming from like any disease you actually have. It's just basically based on the way your gut can contain this culture of bacteria. Yeah, so actually, that's like yet another topic we can talk about this, and we can keep
But
them
I
for
love
the
that though. It has its own nervous system and it makes its
yeah
own the gut makes its own neurotransmitters.
yeah.
Yes.
It's its own, like it's its own little thing. It's so cool. Go ahead though.
About neurotransmitter, I read somewhere that it's a quote by one of the physicists, that the number of neurons in our brain, there are like billions of neurons in our brain, right? And the number of connections they can make together is like all the metrics. If you have connect each neuron with every other neuron, which doesn't actually happen, but if the number of connections it can make is more than the number of atoms in the whole universe.
Oh my God.
Scientifically.
Yeah.
So it's so much powerful. Like brain, the potential of brain is so much powerful.
It's so powerful.
Is more than the universe. That the scope is so high.
That actually bridges to my question, which I had for you. So let's talk about the neuroplasticity here, and also the brain aging, which those two things go together.
Okay.
So we, as human beings, we are born with like trillions of like neurocells, right? So but they are kind of, underdeveloped, and they have this capacity to form connections, to grow, to shrink, and so on. And then as we age, the number of cells is decreasing, steadily is decreasing. So that's again, that's my understanding, my knowledge. So you can tell me if I'm totally off.
You're not off.
So essentially, neuroplasticity is this ability to brain to form new connections, but also when the brain is just this unconnected jelly of brain cells, it cannot really do anything. So you're a vegetable essentially, because you don't have any skills. You don't know how to coordinate your thoughts and so on. So that's why the toddlers, the infants, are so helpless, because they just don't know anything at all. So this decrease in number of cells, the cell death, comes together with gaining new skills, and sometimes you all those extra brain cells you have, they are not helping at all. On opposite, they're just harming you, because you cannot just create as many connections as you need to gain the necessary skill.
I'm actually gonna look something up now, because I just want to this is my
We made you Google.
Look at that. It's my presentation. It's like a presentation I have. So let me see if I have it here. So my I just don't want to leave anything out, but so like I said, neuroplasticity is my passion. And I personally looked into somebody's excited. They're
Thinking it's a bird.
Butterfly.
It's a squirrel.
So I looked into it personally, and I studied the top 12 hypotheses on how our brain ages. It's not just the loss of cells or neurons, it's the loss of function. You can be there and just be a pretty face and not do anything in life and in the brain. Yeah. So I gauge that there's about 12. There's brain atrophy, which is the brain shrinkage, which is the loss of neurons and lack of communication between them. There's redox stress, which is that whole reduction oxidation process, where that's the role where antioxidants come in. And then there's neuroinflammation, which we all know about, especially in COVID. People talk about cytokine storm and inflammation. But inflammation is huge and very damaging. Inflammation is the etiology of a lot of the neurological problems that affect young people, like multiple sclerosis. And then there's others. There's the telomere hypothesis, which is, how on chromosomes, there's little caps on them. We have 23, right? So there's little caps on them that protect them, to keep them intact, to keep them good, so that they can keep reproducing perfectly. We don't have telomerase, which is the enzyme that helps keep the telomeres intact. Some animals do, like lobsters, and they may die from battle, but they really don't age. They don't age. They're always the same, because they have their telomeres are perfect. There's the gut-brain axis. There's neuroexcitation, which is that whole NMDA glutamate thing, no MSG in the Chinese food kind of deal. But together, they all fit together in a certain way, that the way in which our brain ages is really determined by a lack of integration between neurons, a lack of communication between neurons, a lack of controlling and regulating things on an upper level to control everything that falls downward. And that's what really breaks down as we age, because things have to reproduce and reproduce and reproduce. And with time, more and more microscopic errors accumulate. That's just the way it is. It's an imperfect system. So as an aside, and this is something I've been doing since I was at the NIH, I developed a brain health supplement, which I called Brain Theory number 12. And I trademarked Brain Theory, and then I wrote a patent. It took me a while. It's 35 pages of nerdy stuff. Oh gosh. And I submitted my patent, and I have my Brain Theory, which is it's an evidence-based supplement that mitigates the different ways in which our brain ages. And I used the 12 different hypotheses on brain aging. And then I found a respective phytochemical that has evidence in randomized control trials, legit research that counteracts that way in which our brain ages, and then sort of put it together. Now, of course, it's not like a miracle. Nothing's a miracle. Anybody who promises you a miracle is full of shit. So,
What you're sensitive to.
so, but I was so like turned off by all of the stuff out there that just seems like all talk and no substance, that I thought, this is substance with a little talk, but mostly substance, and it's not perfect, but at least it's mindfully done by like somebody who actually like
Does research.
does it and understands it. So, I mean, I think, you know, I got off tangent. I don't know what we're talking about.
No, perfect. Keep going.
Yeah, so that's what I'm working on, and what I would love to do in the future is once I launch that, and then I have that, and build upon that other supplements like for focus and for this and for that, for different things, because not everybody's interested in brain aging, even though we all should be, because we start aging the day we're born. But
Yes.
people want to like be cute and
true.
focus and want to like, but in the end, it's pretty much all the same, right? Is I want to develop like a brain. That's the title I gave it, brain theory. So Brain Theory Institute, right? Where we have like research and philanthropy, and like my ultimate goal before I die is I want to apply neurointerventional surgery to neuroplasticity. So like I don't know, it may not happen, but I'll try, whatever. I have a long time to go. I'm pretty young. So I want to deliver neuroprotective agents within the brain, or within the blood vessels of the brain. That is like extremely cool, because it's not extremely scary. It's not very invasive. It is, you're in the brain, but you can't see it. And it's very targeted. And I think like now there is research that, that I've done in the past, more for like stroke and things, doing stem cell research and stuff for the brain and neuroplasticity and recovery after brain injury. But I think it would be so cool to like do this not only for recovery, but for enhancement and augmentation of the brain.
Oh my God. This is some Elon Musk conversation about to start, I think.
So that's a whole like a thing, but in the right hands with a decent human being, it has, these things are really cool and really possible. They need to be in like decent human beings' hands, right? With like some sort of moral compass and some sort of ethics and some sort of moral compass, because things like that are not right in the wrong hands. Because there needs to be a time where you say, just because you can do something doesn't mean you should. There needs to be a step back where you say, should I do this? What is it for the well-being of XYZ or mankind or whatever? It's not just, so that's my pipeline dream. And I think it would just be something, I just want to make like a neuroplasticity, neuro health institute that's completely void of all of the things that make medicine bad. Like all of the people who are not in the medical field to have hands in it, right? Or I want it to be a purist thing between physician, scientist, patient, like just doing the right thing. That's the goal.
Yeah, you can start with just a supplement for now, right? And then grow into the whole institution.
That reminds me of saying it's called, even like all not wars are fought to win, or even if you are the last person or the only person, there are many wars you win to show that there was someone who was still fighting when everyone else gave up.
Yeah, some wars are not worth starting. It's like a shorter version of this.
Yes.
And even if you are the only one, you still fight to prove that there was someone to fight. So that's amazing. It's very interesting topic. I guess this topic can go for like hours and hours.
We'll have more.
How much the ethics of it? Where do you stop? Like, what is ethical? What is not?
This is like decades away. From my decades away.
Do you think that it's coming? Right, it will happen eventually. Like maybe now, not now. Maybe like in 1,000 years, 2,000 years, 3,000. This kind of thing will happen because the technology will be so advanced. But the thing, like, who is starting it and who is the right person? Like,
so I mean, as much as I think it's cool in my brain, in my mind, I also realize that so much is going on in the world, and there's so much suffering, and there's so many people who don't even have basic things, that it's more of my like nerdy quirk that makes me want to get there. But I think a big part of it is just fairness and giving basic neurological treatment to people suffering in the developing world. That's much more important, you know. And I think that whenever I get like ahead of myself in that regard, as far as like, oh, let's do all this cool, I think wait, take a step back. There's people who can't get a stroke thrombectomy when they are having a stroke in Haiti or in whatever. It's not fair. It's not so a lot of like my nerdy passion takes a back seat to the idea of like global health, which is not like a super nerdy weird thing, but it's something I'm also really passionate about. And one of the things that I really want to do is, I mentioned before about like mechanical thrombectomy, which is the procedure where we go in and try to remove the clot when somebody's having a stroke. So there's a organization of neurointerventional surgeons around the world who are trying to get together and find a way to make that a reality in developing countries, in like low and middle income countries. And I'm actually Haitian American, even though I'm, you know, don't fit the typical phenotype, but I am. And one of the things I want to do is, like for a lifetime, like it's something I'd want to do like over my life, is to try to increase access to mechanical thrombectomy in the Caribbean, in Haiti.
Right.
And that's going to be a hard thing to do because logistic wise, like it's hard. You have to get there, find equipment, you know, train people to do it. Like it's like a very long-term goal. But I mean, it's really nice that there are other doctors who want to do that too. And you know, as one thing that we talk about is that a lot of places don't have basic access to water, basic access to things. So why would you want to have like this mechanical thrombectomy, which is like a very intricate, expensive sort of treatment? But I think to myself, you know, stroke is the leading cause of disability in the world. Not the leading cause of death, but a disability. And that burden is even heightened in the developing world. So I think, you know, there are so many resources that we have that if we divulge in the right way could really make a difference. Just leave it at that. But I think it's only right to give people in the developing world not only access to the basics, but give them the opportunity to have access to what we have too. Even if I think things should happen concurrently, not in isolation. They shouldn't have mechanical thrombectomies in 40 years. It's not right, because we can easily go to a comprehensive stroke center here and just have that opportunity. So I try to take a step back with that like pipeline dream, weird neuroplasticity stuff and balance it out with the global health aspect of things.
This is so true. There are so many problems unsolved yet, and like for us, like we're sitting here and thinking like, oh my God, my Instagram account was like hacked or something. The biggest problem is your Instagram account got hacked, but like look at
the temperature is like who made it 72? I like 71. Oh my God, my life is in ruins.
Yeah.
Yeah, man, like one thing that's helped me get through all of the hard times, as far as it's a lot of different things, is that anytime I feel like complaining about working for I don't even want to say how long, and not having any time to do any, like, I think to myself, you know what, Farah, you're sitting here and the people around you in the ICU or wherever you are, this is the worst time of their life. There is no greater problem than having some sort of traumatic brain injury or massive bleed in your brain or whatever it is. For that person and their family, this is the worst time in your life. They're not all 80 or 90. Some of them are 20, 30, 40. Okay. For you to complain about some minuscule thing in the grand scheme of things is completely so wrong. So I've done that. Like, I do it subconsciously now, I think. I don't know if it was ever something I voluntarily did, like to help, like, to just get myself over little loops and humps that are really irrelevant in the grand scheme of things. But it's become automatic, and then it makes me feel so much more. I like get not emotional, but I get like, I feel what they're feeling, and it just allows me to like to crack the shell around myself that makes me think of myself, and gives me the chance to take in whatever they're experiencing. And it's made like it's made me not cynical, and it's made me like
More mature.
love.
Yes, it matures you. Um, More empathetic. Um, you understand stuff. Not bothered by small problems. That's the biggest thing.
Yeah.
You can do so much more if you just focus on the bigger
Yeah.
problems.
Yeah. Like half the time, like when I see people sitting around complaining, you could like be finished with what you're doing if you just did what you needed to do and stop complaining. Like,
Mm-hmm.
like 20 minutes, like, oh, this sucks, this sucks, this sucks. But if you just like didn't say that and you finished, you'd be done, and then you could go party. You could go do whatever you want.
Yeah.
Okay, let's change the mood.
We only have 5 minutes
5 minutes,
before
okay.
we need to wrap up.
Okay, you have some last minute questions?
Yeah, I wanted to wrap up on the neuroplasticity. So basically, brain aging comes in three different ways: the shrinkage, the inflammation, and then the third, like plaques, right? Which you mentioned.
Yes, yes.
So if I want to retain my ability to use my brain, I still need some form of neuroplasticity, the right amount of it. So as we mentioned in the beginning, too much of neuroplasticity is maybe too bad because you just can't acquire the skills, but not enough is when you start to lose function. So like from your point of view, what would be the best, what can you do now at pretty much any age which will prolong your ability for neuroplasticity?
I think from a lifestyle perspective, and it's probably eating healthy, like Mediterranean diet kind of thing, because a lot of those
My favorite.
a lot of those items have antioxidants and anti-inflammatory properties. Drinking a lot of water. I am trying, I'm trying. Drinking a lot of water, because that keeps the brain fat, keeps the brain full, keeps the brain from shrinking. And then aside from that, it's really just, you don't, as the saying, you don't use it, you lose it. Really learning new skills and continuing to learn and learning things outside of your comfort zone is actually extremely beneficial. There's like functional MRI studies and different things that show that brain activity increases when you learn something new, when you apply yourself, and not with the idea that you're going to become some sort of professional about it, but it does wonders for the brain.
Exactly.
So really, those things are like, they seem pretty basic, but doing them like very in a dedicated way does wonders. You have the opportunity to change your genetics, or to change your, what you're supposed to do, and put it in the right trajectory.
Okay.
Amazing.
So keep learning, stay healthy.
Yeah, and I can also add to this that this one activity which all of us do, not enough, I believe, in modern societies, we don't pay enough attention to quality of sleep and the amount of sleep we are getting.
Oh my God.
You see, like memory depends on your ability to have REM sleep.
You're so right. And so sleep is extremely important. Sleep is the time where your brain actually clears all of its toxins.
Right.
So all of the abnormal proteins, the proteins that accumulate in the brain and cause like Alzheimer's and Parkinson's and all these things, they get cleared out at night. And your brain consolidates memory and consolidates learning at night. And even some of the neurodegenerative diseases like Alzheimer's and Parkinson's, looking back on those people a decade before they started having symptoms, they often have a sleep disorder, like REM sleep
disorder.
Yes, so sleep is extremely important. It's when the brain like resets. And quality of sleep, not just like an hour nap or something, but sleep is extremely important for brain health.
My favorite topic. If folks you snore, go and do sleep study. You will be surprised. I use a CPAP and I'm not even there.
You?
Yes.
You're
my life. It's a life-changing thing. Like you have no idea. I'm able to do 3 times more with my life. Like you know that, right?
God.
So like I can sleep sleep less, better, recover faster, and I'm a very different person just because I changed.
Sleep apnea. My gosh.
I think all of us have it. It's just not enough, not getting enough sleep studies.
Yeah.
There is like some acceptable level of like stopping breathing during sleep, right? So you can have like episodes of stopping breathing up to like five episodes per hour. In my case, it was like something like 37. You see?
Oh my gosh.
Yes, and that's how I got CPAP. But it's a life-changing thing. I recommend everyone to get it.
Well, I'm glad that you are compliant with the CPAP, because a lot of people, they find it uncomfortable and then they don't wear it, and it's like, oh my gosh. You pretty much, like you were saying, if you have episodes where you don't breathe at night, you're not getting enough oxygen to your brain. You can feel tired, you'll get headaches, you feel foggy. It increases your risk for like things like, if you don't treat it, things like stroke and things like that. So
Early
kudos
death.
to you for doing that,
Oh,
really.
thank you. All right, Dr. Farah, thank you much for finding time to talk to us. And let's talk about the future for just a couple minutes. If folks are curious about what you do, how can they find you? So we're going to put your Instagram account below. Any other like ways for folks to connect to you? Follow your IG, for example, maybe some kind of like email, some kind of like website you want to mention here.
Yeah. So my Instagram I use is I_am_Farah, Dr. Farah, DR, and then my name. I mean, I'm pretty, like, I work a lot, but I can take time here and there, like,
Application.
Yeah, I can take a day or two.
So yeah, it was wonderful talking to you. And any last thoughts you wanna share?
I really want to talk to you guys more.
Well, we'll make it happen.
We'll make it happen. Yes.
Hold up.
Yeah, there's so many topics.
Hold
Like
up.
we just wrapped up right now, and then we didn't touch it.
I just
but
want to keep talking to you guys. That's pretty much what I have to say. Is
I
have
had a bunch of
something to
stuff,
say.
more stuff to talk to, but we are running out of time.
Mm-hmm.
So let's
That's
continue
okay.
it some other time. Okay, awesome. It was wonderful talking to you, and wonderful to have you. And thank you for the time. Really appreciate it. And you are looking fabulous. Okay.
Thank you. I don't know how that worked out, because I stayed up all night doing my presentation for today, but thank you. Whatever.
We can apply some filters. That's the power of post-production.
We have post-production.
All right, guys. So this was
go on. Yeah. Thank you. And
this was Dr.
You will find the Instagram links for both the Instagram links somewhere down here. And thank you. This was Sublime Productions.
Yeah, this was Dr. Farah Fourcand, and she's a neurosurgeon and a model at the same time. We are going to have more of really good conversations with her, as well as all the other very interesting guests. Episode 5 of Podcast Studios. We'll see you next time. Bye.
Ciao.